Hi everyone, this is Annie Miraj Kidwai and you're watching Vertex, the solution of every need. How is everyone and how is everyone doing today? So ladies and gentlemen, I am going to talk about psychotherapy, that is CBT, in this video because recently I've posted a video on um, dissociative identity disorder where I've got some questions about the same. So what is psychotherapy? Psychotherapy is a talk therapy. It is a treatment plan used by clinical psychologists for the clients or the patients. Okay, and cognitive behavioral therapy is one of the um, line of action used by the psychologist on the client as a psychotherapy. Now, what happens in cognitive behavioral therapy? What the psychologists do and how it works? Well, in cognitive behavioral therapy, which is a talk therapy, let's say about 50 to 60 minutes of a session with the therapist, with a clinical psychologist, the therapist understands the problem of the patient, the thought process, the levels of thinking, inference, evaluation, and the patient's belief, understands what and where he is facing problems in his day-to-day activities, also analyze the patient, that whether he or she is suffering from any sort of a mental disorder, mental illness, personality disorder, etc. These kind of therapies, like cognitive behavioral therapies, are pretty helpful for the patients of depression, anxiety disorders, personality disorders such as dissociative identity disorder or schizophrenia. Um, Now, what they do in this therapy? They modify the behavior of the patient or the client in this therapy after complete analysis of the problem. For example, I spoke about dissociative identity disorder, which is not curable but can be controlled with CBT or a psychotherapy. So in this disorder, I was already spoke about it, that the patient gets dissociated from the reality and creates alters in their mind due to some trauma, or that can be the cause of having a dissociative identity disorder. Is also correlated with borderline personality as well. So they create a treatment plan of action according to the requirement or the need of the client or the patient. For example, for depression, it can be different. For anxiety disorder, it can be different. Schizophrenia might be different. Techniques may differ from each other as per the client or the patient. Now, how it works? So they modify the behavior. Now, behavior modification is, of course, about the thought process, the levels of thinking, right? I would not say that CBT brings positive thinking in the client. If somebody is sad or upset about something, it is but obvious that it will take time. So saying that be positive, think positive will not work on the patient. So how it works? Well, there are certain emotions or feelings which the patient is not able to feel. So the CBT therapy is designed in a way for the patient to make them feel the real emotions as far as their experience is concerned. Any kind of blocked or restricted emotion they are unable to feel or react to respond, the CBT therapy helps them to relate to the real life experience. For example, schizophrenia. So there are auditory hallucinations also happen in schizophrenia. The patient hear a lot of different voices in their head and they react in a shocked way sometimes, who is speaking, what they are saying, etc. So it creates a thought process in the patient that is realistic. And when the thought process is more realistic to the experience, it is more uh, correlated with the reality of the patient's life, rather the imaginary or imagination, or probably the alters and dissociative identity they create in their mind. So the behavior modification is there. It's quite in depth. Cognitive behavioral therapy. There are a lot of techniques. One of the technique I can tell you that self-monitoring, which is used for the patients, that they record their own behavior, they record their own responses and reactions to a certain situation, and how they felt, what emotions they felt during that situation. So they keep a record. That is a self-monitoring technique, as a homework or an assignment given to the patients who are going through this therapy. So it can be helpful in depression, anxiety. We must not restrict ourselves in achieving the goals and the targets of our life. So if ever you feel that you are unable to achieve the targets and goals in your life, and something is stopping you, you are mentally not feeling fit, you are not feeling fine from your gut, you believe that your self-confidence, suddenly your self-confidence diminishes, your self-esteem diminishes, you isolate yourself, you have some negative thoughts in your mind and it goes in extreme. Maybe you become too angry, get triggered easily, or you completely shut off yourself from the outer world, you're not interacting with anybody, or any kind of behavior that you realize in the people around you, the family members, which you may find a little different from the normal. So you should definitely walk into the office of a clinical psychologist, and they can surely help you with this. Psychotherapies, talk therapies sessions are the counseling sessions specially designed as per the client or the patient's requirement or the necessity, after completely analyzing their problem, evaluating what is the best technique that can be used, that can be helpful for the patient. So this is the short and brief video on CBT. I'll be uploading more about the ABC model and various other techniques used in CBT. So keep subscribing to this channel, liking and sharing it. And if you have any doubts, reach to me. You can also book a free counseling session with me, and I can help and try to help wherever I can. So you can trust us, and any kind of a medical treatment, if it is required, we'll definitely help you out with that as well. So thank you so much, and have a great day.